Hello, my name is Ambereen AbdulAlim, and I'll be a senior at Horizon Science Academy. I'm in the Science Internship for Nursing program, and my mentor is Pam Alessandro at Marymount. We worked at reducing hospital readmission rates for CHF patients. Congestive heart failure is a condition in which the heart muscles can no longer pump enough blood to the rest of the body. It is the most costly diagnosis in the Medicare population and also the most common cause for hospitalization in patients over 65. The majority of CHF patients have comorbidities, many of which contribute to their heart failure, such as hypertension, coronary artery disease, diabetes, sleep apnea, and kidney disease. Symptoms include edema, dyspnea, chest pain, palpitations, fatigue, abdominal bloating, and loss of appetite. Treatment includes lifestyle changes such as a reduced salt diet, weight management, limiting fluid intake, and medication compliance. Medications include diuretics, which are water pills that remove excess salt and water from the bloodstream, inotropes, stimulants that improve the heart's pumping action, vasodilators, pills that enlarge the small blood vessels, and beta blockers, drugs that slow down the heart rate and lower blood pressure. Here are two examples of beta blockers, carvedilol and metoprolol, and Lasix is a diuretic. Marymount CHF Clinic provides specialized nursing care and education for patients diagnosed with CHF, helping them better understand the condition and how to manage their health. Regular follow-up appointments are recommended. That is why the new initiative, Hospital to Home, has emerged. The goal of this initiative is to reduce all-cause readmission rates among patients discharged with heart failure or acute MI by 20% by 2012. The Hospital to Home initiative, led by the American College of Cardiology and the Institute for Healthcare Improvement, is a national quality improvement campaign to reduce cardiovascular-related hospital readmissions and improve the transition from inpatient to outpatient status for individuals hospitalized with cardiovascular disease. Through this program, hospital readmissions should decrease and thus decreasing the billions of dollars spent annually. In this program, a 7-day follow-up appointment is ordered and scheduled with someone before discharge. I hypothesize that if CHF patients are seen within 7 days of discharge by a healthcare provider in the office or through the CHF clinic, then the hospital readmissions will decrease. All heart failure patients admitted to Marymount between October 1st to June 30th were analyzed for their frequency of admission, length of stay, whether the 7-day appointment was ordered and scheduled at discharge, who the follow-up appointment was with, and whether it was kept. This is a graph showing the age breakdown of male CHF patients, and a majority of congestive heart failure patients are between the ages of 71 and 90. And this graph shows the age breakdown of female patients, and majority of female patients are also between the ages of 71 and 90. This is a graph showing the length of stay of CHF patients. Majority of them were in the hospital between 5 to 7 days. There were 578 CHF admissions from October to June. Among all these admissions, 158 were ordered with the physician and the CHF clinic. Of those 158, 88 were scheduled and only 51 were kept. Readmissions have been steady at 3 to 5 until June when it hit 7. This is a graph showing the destination of patients and where they went after their discharge, and a majority of patients were followed up with their physician. Results. Since October 2010, there were 578 CHF admissions and 3,855 days spent in them. The readmissions for heart failure were higher than expected in June. 2 of those patients readmitted had their appointment ordered and scheduled for the clinic, but were readmitted before the first appointment. And one of those frequent readmissions has worsening kidney disease and is currently being prepared to have dialysis. Conclusion. Marymount Hospital has a high patient population admitted with heart failure. The CHF readmissions within 30 days have been steady at 3 to 5 a month until June, when there were 7 readmissions for CHF. Overall, the readmissions have been equally distributed between patients returning from home and patients returning from a skilled nursing facility or long-term care facility. 26.4% of these patients admitted with heart failure, we had insufficient documentation for follow-up at discharge. I recommend the Hospital to Home program to be continued, utilizing a better data collection tool to record patient discharge and follow-up information, appointing a designated person who calls a patient 2 days after discharge to confirm follow-up appointment, better education of heart failure management and treatment for nurses at skilled nursing facilities and home health care facilities. There should also be better communication between these agencies and the CHF clinic as to provide better care. Also recommend keeping a designated nurse or a nurse practitioner to identify the inpatients with heart failure and help coordinate their follow-up care. Thank you. I would like to thank my mentor Pamela Sandro, Beth Nelson, and Jane Bender.